All right, good morning, everybody. This is Jessica with the Community Foundation. Welcome, everyone. So glad that you could join us this morning for our second in our virtual Meet Yourself sessions. So today we're going to focus on mental and emotional health for adults. If you all can see my screen, can you just give me a quick thumbs up there? Good, excellent. Okay, I'm going to kick us off, and we've got a lot of great speakers that are going to be talking today over the course of our time. So very quickly, for those who might not be familiar with First Steps, this is a network of dozens of different organizations and individuals that have been working since 2016 together on ways to improve services to young children and their families. When we kicked off this work in 2016 through a series of community conversations, we came together around three shared priorities. The first, to create an information hub so that we can better understand and disseminate information about the many services that are available in our region. Working to speak with a common voice about the importance of early childhood, and then supporting and strengthening the early childhood education and development workforce. And we have working groups that focus in each one of these areas. These Meet Yourself sessions are the result of work from this information hub group that is our longest serving, has been meeting since we started. And many of you have probably attended these in-person sessions, but we decided amidst the pandemic that we wanted to continue these, but to do them virtually. So we, 2 weeks ago, had a great session on mental and emotional health for children. That recording and the PowerPoint from that session are on the Community Foundation's website. If you go to the COVID-19 resources, the First Steps resources page, it's there. And this will be recorded as well. And then towards the end of the session, we'll talk about one more upcoming session that we have planned. So today we're going to focus on mental and emotional health for adults, so the caregivers of young children and families. And we've got three great speakers: Andy Gillespie from NRV Cares, Jenny Martin with the Virginia Foundation for Healthy Youth, and Katie Thompson with Honeytree Early Learning Centers. So a couple requests, as you can see on the screen. Many of you have done this already, but mute your microphone if you would, so we don't have that background noise as our speakers are talking. And then we're going to use the chat box for questions. So as you have questions that come up, go ahead and put those in the chat. And Robin is going to be monitoring those for us and asking questions to our speakers at the end of their various comments. And then we'll have time as well overall at the end for any additional comments. So with that, I am going to turn it over to Ashley Hash with Carilion Clinic. She's going to kind of MC us today, working through our three speakers. So Ashley, I will turn it over to you.
Thank you, Jess. As Jess said, my name is Ashley Hash. I am the community health educator with Carilion in the New River Valley. I've been involved with First Steps, I think about 2 years now, and I joined First Steps through one of these Meet Yourself, just like today. So our first presenter again is Andy Gillespie, and she's gonna be talking to us about self-care and stress management in this time of COVID.
All right, thank you, Ashley and Jess. I'm the executive director. I'm Andy Gillespie. I'm the executive director with NRV Cares. I'm also a licensed clinical social worker. And so I'm going to kind of touch on some mental health, adult mental health in the time of COVID-19, because I think we're all hearing about it now, which is a good and bad thing. And so I think it's good for us to kind of shine a light on it. And instead of kind of grabbing one of my friends that's a therapist doing telepsych, I felt like we needed to keep them doing those appointments. So here I am trying to kind of shed some light on what's going on. So Jess, if you can go to the next slide. All right, so what we definitely know now, whether, there's so much mixed media going on, but I will say one thing is for certain: we know that there is an increase in anxiety and depressive symptoms for people who already were experiencing those, but also more of an onslaught of seeing it increasing in Americans overall. Just today I was reading an article, I didn't look at the date, I think it was posted within the last 2 days, from the Washington Post, in which it was stating about a third of Americans are reporting symptoms of anxiety and depression. That to me is no big surprise given the situation. And so we know this because of the isolation, the unemployment, which then brings a lot of financial burdens, the fear of unknown and worry about health of others. And I think that fear of unknown is a pretty strong force because we know it underlies a lot of things. And in this situation, we're a fear of, something we can't even see or do much about in those regards, because it's very hard to know when this will end and when that's in sight. So we know folks with substance use disorder and existing mental health issues are very vulnerable, and they're having exacerbated symptoms right now because obviously the isolation doesn't help their situations. We also know frontline workers are working extra long hours and have a fear of contracting the virus. Those working from home are balancing the work-home life. And then we have parents working from home that are balancing working, teaching, and childcare. So, one thing is, there's a light being shined on mental health right now, and thank goodness for that, because we're all seeing this. And so no matter the situations, we all share this commonality. Unfortunate as it is, I will say that article from the Washington Post, as it mentioned, there's tons of money that's being put into COVID-19 relief efforts, and mental health didn't see a lot of that. And so I think it's important now that all this is coming out so that funding is being put to those resources, because otherwise, I think what we all know and fear is increase in suicidality and substance use disorders, things like that. So we definitely need that light being shined on it, albeit, a double-edged sword. I'm glad to, hopefully it'll come with some good. One reason we're seeing such an increase, another reason we're seeing such an increase, but one big issue with this increase is that it's hard for people to recognize the difference between, if they're really having anxiety and depressive symptoms or if it's just the situation. And that's because, everything is messed up right now. So it's really hard to know. So when people are having changes in their weight, could it be because they increased some baking because they had some time on their hands, or is it because truly they're depressed and so they're eating a lot more? Same can be said for the weight loss. Are people able to walk around more and so they're losing weight, or is it because of the anxiety and they're actually eating less and so it's at an unhealthy balance? So it's hard to know exactly that. And it's the same with sleeping. We look at sleep as a big factor to help us determine anxiety and depressive symptoms, but because we're not having to getting up much earlier to get ready for work, things like that, our sleep patterns are off. And so that could be, we could dismiss that as an indicator for us that there is an issue. And so Jess, can you go to the next slide? All right, actually go back to the other one. Sorry, I jumped the gun. Thank you. Sorry. And so what's happening is with any trauma that, we talk about trauma a lot, the light has been shined on trauma, and right now we're all experiencing that trauma, is that with that, there's a normal adaptive response that we know. It's fight, flight, or freeze. However, right now, we're kind of staying in this chronic state of one of those. And so that's, again, why I think a lot more people are experiencing the symptoms that they're experiencing, and it creates those feelings of anxiety, ongoing stress, and depressive symptoms. And so people may feel irritable, exhausted, anxious, hypervigilant, angry, and emotionally dysregulated. And I don't know about you guys, but I definitely identified with a few of those, that's for sure. And so when you have interrupted sleeping patterns, interrupted eating patterns, and your routines being interrupted, that's kind of the recipe for a mental health disaster, and which is, just really, really unfortunate. And so like I, mentioned, a lot of us are all in the same boat in the sense that all of our lives are being interrupted. I think we all have different experiences, but because lives are being interrupted, I think we need to have some grace and, a non-judgmental stance towards people. And so one area that I could speak to, it was the working from home and balancing the children at home. And so Jess, you'll go to the next slide now. And so I made this slide, and I want to be very transparent that these were just things that were helpful sometimes for me. Nothing was foolproof, as many of my staff will tell you. And there are multiple stories of my children coming in on a Zoom call talking about their bowel movement. So with that being said, these were just a few things that I found to be somewhat helpful. And so I setting up breaks and attempting to schedule meetings during naps. And again, that's kind of comical because it's hard to control when that nap might be. But I did find that, when I did have that hour, it was helpful to then take a call or something like that. When I was on the breaks, I would often just try to be present with the kids and give them that one-to-one attention as much as I could. Again, nothing is foolproof. The phone may ring, an email may come in and divert the attention. But when I did, I noticed that later when I needed to then take a break and do some work, it went over a little bit better. If children want to be present with you, giving them technology or an activity they can do with you and next to you, headphones are fantastic for that as well, for them, for you, and it makes it a little bit easier. Of course, outside time, and I know Jenny's gonna talk on that, so I won't go too much into that, but I know that vitamin D was huge for us. And one of my children is, does not like going outside, so it's forcing her, but when she's outside, she does great, and I think it's very much necessary for her. Be okay with messes and creative play. We got really familiar with mud and mud play, and it was actually this weekend, my 2-year-old goes in the mud, and my husband's like, no, don't do that. And I said, oh no, we do that now. Like, this is part of what we do now. This is our everyday life. And it is, and it wasn't something that used to be part of our lives, but now it's very much a part of our lives. And finally, be kind to yourself. Others know you are trying your best. I mean, I know we all have had those moments. Kids are coming in. You're embarrassed. You're trying to talk, and it always seems to be when you're trying to talk that they then pipe in. I find that comical. It's like a radar they have on them. And I think we're all trying to get through what we're trying to do. And I'm always hopeful that everyone on the other end is getting that we're all doing our best. And I have noticed that. I think there's a lot of grace. All right, Robin has given me the warning. I'm going to keep going. Next slide, please. I will get through this. So I found this great infographic from the World Health Organization. You can just Google it. It'll come up, and it really summarized a lot. I'm, again, not going to go into too much because I know Jenny's going to hit on that. But I really liked some of the things, such as limit worry and agitation by lessening the time, because I think that can be really troubling. And so, and as well as getting the facts. And gathering information that will help you accurately determine. So sorting through what you're getting, I think that's helping. Don't use smoking, alcohol, or other drugs to deal with emotions. I think with that, having a happy hour and a glass of wine with your friends via Zoom, I think is helpful. But I also think it's, of course, limiting it and knowing that you're not doing it to cope and completely be using that to take over. And so I think I definitely encourage you to go look at this. And then finally, Jess, if you go to the last graphic, the last slide. And then this was an infographic I found recently too about when you're feeling anxious. And I really liked these things. I thought they were really helpful. I've encouraged patients in the past to do these things. I think there's something on the list for everyone here. So just a few things. I hope I'm trying to stick to that time, and I'm open for any questions when we have that time. Sorry to race through it at the end. And, I think above all, just try to know try to be in tune with yourself as much as you can. And if not, asking someone else, hey, do I seem normal? Does everything seem okay? And you may need to ask someone who's not in the home with you, because that might be the person that, they know you too well. So you need to take someone on the outside and say, hey, do I seem off? Because we need to know, you need to be in touch with yourself, but it's hard to know that right now. So, and seeking extra help if you've gotten to that point. All right, I think I'm good. Do we have time for questions, or should we save those till the end?
I don't think we have any questions as of right now in the chat. So I just wanted to say thank you for normalizing that, balancing working from home and taking care of kids. I mean, I think it's often we're starting to feel like we're not good moms, and we're not good caregivers, and not good employees at the same time when we're trying to do both. So I really appreciated that, and I love all of the tips that you provided. So thank you so much, Andy. And I still don't see any questions coming through. So I think we're gonna go ahead and move ahead. If you do have questions for Andy, feel free to pop them in the chat and we can revisit later. But next up, we have Jenny Martin from the Virginia Foundation for Healthy Youth. And she's gonna talk about how we can take care of our physical health that also contributes to our overall well-being during this time of COVID. So Jenny, it's all yours.
Awesome. Thank you, Ashley. And thank you, Andy, for such a nice sort of segue right into physical health, because this sort of balance that we're talking about is so important right now for adults, especially as they're spending extended time with their kids at home. And then for you all as practitioners or people in early childhood, you know, you're going to be interacting with parents or your clients and really being able to feel like you have a handle on some self-care tips and tricks that you can pass along for everybody's benefit. So just quickly from our organization's perspective, we work to empower Virginia's young people to make healthy choices. And so, as I mentioned, this intersection right now with adults is really critical because adults play such a huge role in guiding health decisions for young people. They do modeling of health behaviors, they offer choices, and they help create norms around what are healthy coping skills, what are healthy eating habits, what are healthy physical activity options. So again, I think it's a really unique point in time for us to kind of jump into this work together. And I'm thrilled, again, that the First Steps group has prioritized so many of these health promotion efforts. I've been in health promotion for 22 odd years, and I'm still amazed right now to hear so much about self-care. Like, I feel like health has gotten a makeover in some way, because it used to just be called health and wellness or health promotion. And now there's a lot of buzz around self-care. So for me, I'm actually a little bit excited about this moment in time, because I do think as much as there are things that are scary and unnerving, and certainly things that we have no frame of reference for, personally, having not lived through, we do have an opportunity right now to point these out as like, oh wow, these are healthy behaviors, like how cool. So if you want to go to the next slide, Jess, we'll talk about how physical health is really just one piece of the puzzle. And you all, many of you know this already or have seen something similar with relation to even social determinants of health, that there are a lot of different factors that really go into how we all choose healthy behaviors and carve out health for ourselves. So SAMHSA describes wellness as not just the absence of disease, but really the presence of optimal living. So, you know, you're talking about physical health, behavioral health, having a purpose in life, active involvement in satisfying work and play, having joyful relationships, and happiness. And it's like, yeah, that's a pretty tall order. I will not be afraid to say that right now. Like, our pursuit for wellness is tricky, especially right now. So to be able to have patience with all of this as we all kind of pursue this work together, I do think it's interesting that when we talk about the leading causes of death in the US from a public health perspective, you know, you're talking about cancer and heart disease, and many of those have modifiable risk factors. So things that we do have control over. And a lot of those are lifestyle choices. So when we focus on wellness for everybody, you know, we help improve people's quality of life. You move from a life that's riddled with chronic diseases and those symptoms and how we manage those and how much work that is and how much trauma that creates, to something that's closer to what we call, you know, living our best lives, and really being able to enjoy optimal living. So to feel good and to go through each day feeling like, you know what, I can handle this, is a really critical skill right now. So I think all of our agencies, you know, working together, I think show that it's going to take all of us. Like, we all have a piece of this puzzle and a piece of this pie, or pizza, whichever you prefer, to help families and to help young people to make good decisions and to be able to work toward this pursuit of wellness. So we'll move ahead and look at the big buckets, as we'll call it, of self-care and physical health right now. And my friends in early childhood might recognize this, like from Sesame Street, where one of these things doesn't belong. So I'll draw your attention to the lower right side, where we talk about reducing other risks. And Andy really mentioned this too, but in terms of smoking, alcohol, or drug use, you know, those three right now, for certain, are ways that we can help promote healthy living for people who need to take a look at those three first and foremost. So if you have the opportunity, or if you have a mechanism within your workplace to promote any of this type of messaging, it's a great opportunity. We have quit lines, we have text programs, there are all kinds of resources about smoking cessation. And if folks haven't considered that, one simple question along the motivational interviewing lines is, have you ever thought about quitting? And interestingly enough, if you ask someone that question, it can be a 20-minute conversation, because as Mark Twain said, quitting smoking's easy. He's done it 1,000 times. It's a very, very difficult process for many, many people with relation to being addicted to nicotine. But we are living in a time where we have more assistance and more knowledge about how to do that effectively and how to help people through that. So if there is one way, that you can help people improve their health, it's to promote that action of quitting smoking. The alcohol use, again, similar to what Andy said, the moderate drinking is defined as 1 to 2 drinks a day for males, and then 1 drink a day for females. But that's not typically the problem. What we think about with problematic drinking is more like heavy drinking that's taking a toll on your daily living and how it's affecting your relationships, and whether that's increasing risk for cancer or heart disease or depression or violence or traffic fatalities, like these kinds of things. So I would certainly refer to New River Valley Community Services and help promote their resources for substance use disorders and for those types of risky behaviors for treatment, and helping people seek out medical professionals where they need that, because there are great behavioral counseling options and medical treatment options. So again, taking a look at those big risk behaviors first can open the door to then some other healthy choices when we talk about these other health practices. So we'll move away from those risk behaviors and then look at the top left and talk about sleep. I'm sorry, still on the same slide with the cute kitten. Sleep, 8 hours is the recommendation for adults, 9 hours for kids. And so this can sometimes be the one that's most underestimated by people. Not aware of how our sleep impacts so much of our daily living, and then the choices that we're making in our waking hours. So it's critical for functioning and concentration and focus and learning. It impacts our hormones, our metabolism, and then how we choose to be physically active or not. So at the end, there are going to be some links to different kits that are online, or different checklists and things. And so I encourage you to take a look at the healthy sleeping tools for families. So it has an opportunity for parents and kids alike to talk through what healthy sleep looks like and healthy sleep practices. So getting ourselves ready for sleep at night, and maintaining routines, and looking at our technology use and blue light and all of these kinds of things. So that's a really critical piece of how we go about making healthy choices during the day, is what happens to us at night and how well we're resting. Okay, so the second bucket there, then to the right, is our fuel, or what we would call food, right? So if we can help folks understand and make a little bit of a shift from just looking at food, our meals, our snacks, what we're putting in our mouth, but really looking at it as how we're fueling our bodies. And if your favorite car is a Maserati, you would not go to a way out gas station that probably hasn't had their tank filled in 10 years and put in sketchy, low grade, gasoline. So if we think about really fueling our bodies with the nutrients and vitamins and minerals that we need, we can begin to look and analyze our relationship with food just a little differently. So when we have messaging for families about nutrition, it can be confusing. It can be overwhelming. And certainly I've had people with their, PhDs look at me and say, I never really learned how to eat right, or what it is I need to be eating. And that's totally okay. Like Andy said, having some patience with ourselves, with everybody right now. Now's not the time, right, to take on these monumental, huge health overhauls. Like, I am not advocating for that in any way, shape, or form. But it is okay right now to say, what are some of the small things, some of the small swaps that I can make, or small changes that would actually help me feel better. And for many people, that's the motivation. They may know it. They may recognize, like, here's, okay, some things I need to be doing, but I haven't done them. And then once they do them, they understand, wow, that really actually makes a difference. I have more energy. I don't feel so sluggish. I don't feel so achy. So with relation to the food environment, you know, we're constantly bombarded with messaging and with options of calorie-dense, nutrient-poor foods. And there's literally not enough hours in the day to burn off the kinds of calories that are available in most American diets. So when we take a look at what is kind of the low-hanging fruit, so to speak, certainly beverages are a big part of that. So taking a look at your drink, whatever it is that you're drinking, sugar-sweetened beverages are a huge, in fact, largest source of added dietary sugar in the American diet. So really taking a look at what you're drinking throughout the day and knowing that water is the absolute best beverage for young people, for adults alike. Sodas in particular, you know, you're talking 18, 19 teaspoons of sugar in one 20-ounce soda. So it's a ton of sugar, which raises our risk for type 2 diabetes and other chronic diseases. So when we know that like taste preferences are established in early childhood, it's super important to be able to model water consumption as the best beverage in the early childhood environment, but also when we're talking with families and parents and what they're doing at home in terms of habits. So Rev Your Bev is our agency's campaign, and we'll link to that later with some resources. Let's see, the next portion is really talking about portion size. So taking a look at the amount of what we're eating, not just what we're eating, but how much we're eating. And the human hand is actually a great measurement tool, and we always have it with us. So it's easy to find, but taking a look at how much you're eating using either your palm or one of your fingers or your thumb. And so Common Health is the state of Virginia, the Commonwealth of Virginia's wellness campaign, but they have a great infographic that I've linked to too about how to look at your hand and measure out kind of what it is you're eating and the amounts, so that we're all coming back to, you know, kind of a healthy, building a healthy plate and understanding exactly how much my body needs in a certain portion or a certain size. And then the last one is aiming for 5 fruit and vegetable servings a day. That seems like a tall order, like I'm not having 5 whole pieces of fruit. I'm not having 5 big vegetables, but, you know, understanding what a half a cup of a vegetable is really important when you look at, you know, trying to build your plates throughout the day. So every single person that you talk to can usually improve on their fruit and vegetable consumption. And so when you start looking at, oh, all the things I should be doing nutritionally, that can actually eliminate some of the room that you have for some of the other calorie-dense, nutrient-poor foods. So the last block there is about movement. And I'd call it movement intentionally to maybe shift some of our thoughts away from physical activity or from exercise, because sometimes that feels like a chore and that feels like, oh my gosh, that's one more thing I have to do today. But simply integrating more movement into our day. Like, we are so fortunate to live in this particular time where we have so many modern conveniences, but certainly we have you know, a sedentary lifestyle. So we're doing a lot of sitting, we're doing a lot of driving, we're doing a lot of hanging out on the couch. So we've got to be able to find even small portions, 10 to 15 minutes a day, right? In little chunks, you can get at an hour. And then the physical activity guidelines for Americans is closer to like 150 to 300 minutes a week. But if you spread that out over a week, and again, look at ways to chunk that, getting more exercise and more movement, more physical activity can be super helpful. Also improving mood, improving how you sleep, and all of sort of the interconnections of some of these health behaviors. So we'll go to the next slide, and that has a bunch of resources, places to go to get either infographics or printables or articles or tips for families that you're welcome to share or ask me for more information. The last one down there is Healthy Floyd, and they're doing a great job here locally in Floyd, promoting that message for young people and for their community. And then the last slide we'll jump to and just sum up with a few things. I've gotten the time notice, so thanks for extending just a couple minutes here. What can we do to help make the healthy choice the easy choice, right? So the vending machine up top, unfortunately, that's not what vending machines look like right now, but we're all working toward that, right? So how can we integrate healthy choices into what we're doing and how we're talking to kids and families? Below that, of course, remember that human nature often doesn't allow us to take warning signs, or to really perceive the risk that we are engaging in. So being patient and with ourselves, with other people, knowing that behavior change is really hard. And so every little step we're taking, right, helps us move in the right direction. So small steps are really important. And then my giraffe up top, if I could give you all anything today, it would definitely be a little quick vacation. I know everybody is anxious for some downtime. But when I think about a laugh or a way to lighten a day, something to make you smile, like these are great things. And when I think about going on vacation, you think about being on an airplane and how the flight attendants tell you to put your own oxygen mask on first before attempting to help others. And so that's, again, a metaphor, again, for physical health, and what we're doing to care for ourselves right now ultimately allows us to help care for other people, whether that's personally or professionally, but that's definitely putting our own oxygen mask on first. So thank you all for everything you're doing to champion wellness and health and self-care right now. Every champion really helps us move closer to a culture of healthy living. And if there's anything we can do at the foundation or that I can put you in touch with as a resource, please let me know.
Awesome. Thank you so much, Jenny. I really appreciated that, how you talked about those healthy changes and how they should feel good to our body. That when you're making those small healthy changes, really recognizing how it makes you feel better and how that can kind of improve the choices that we make. So we did have a couple questions come through. The first one I think is more for Jess and all the presenters is, will the slides be available later?
Yes, they will. So we are going to take the slideshow as well as a recording of this and post it to the First Steps page, and I can send that out, and I'll put it in the chat as well, but we'll post that probably later this afternoon so you can see the slides with the links as well as a recording of this.
Awesome. Thank you, Jess. And then next we have a question. The person states, even though they're making good choices during the day, sometimes the mind is still going a mile a minute when you lay down to go to sleep. Any ideas on what can help help you get a good night's sleep without waking up multiple times at night? So Jenny, do you have any resources for sleep?
Yeah, I believe it's the Alliance for a Healthier Generation, that sleep toolkit. If you go back to the slide right before that, there's a link to it. But it really talks about getting into the habit of kind of winding down at night. And sometimes that's media consumption, sometimes that's looking at your diet, what you're eating at night. But the Healthy Sleep Toolkit, yep, is there on the upper left. And that's for adults and for kids, but certainly taking the time to look at what are your self practices, and then, whether that's meditation or whether that's slowing down and doing some journaling at night, or some of those other tips and tricks that you can try before bedtime, just getting yourself into a sleepy state so that you can rest well at night. I would check that out.
Awesome. Thank you. Yeah. Okay, so I don't see any more questions coming through, so I think we'll go ahead and move on. Our next presenter is Katie Thompson with Honey Tree Early Learning Centers, and she's going to talk about some considerations to take into account when going back to work, or particularly from the director's perspective, reopening your business or child care center. So Katie, take it away.
Alrighty. Hey everybody. So I want to start with just appreciating you guys taking the time this morning to come out. I know that as we've been talking through these first two speakers, the thing we keep acknowledging is this time is busy. This is not a break, and this is not a time where we are absent of work just because we are absent from our office chairs, or some are absent from their office chairs. So I really appreciate you making the time for this morning, and we hope that you'll find lots of great resources to take back to your workplace that you'll be able to use as a leader, or use to support your leaders. So I'm coming today to kind of talk about re-entering the workforce outside of your home. And so I've broken this down into two main categories. So we're going to first kind of talk about what can you do as the employer or the leader, or the person that's helping to make decisions about how things are going to look when your employees come back. And then we'll talk a little bit about, as an employee, what can you do for yourself to make sure that your reentry is as smooth as it can be, and that you're able to address some of your concerns with that. So when we start from the standpoint of an employer, so the person who's having to, sorry, I've got some background noise because I am at work. So when we think about what we can do, 1 second. Okay, sorry about that. So we're going to start with that aspect, the employer. So one of the biggest things that you can do, and the first thing that I'm going to say in both of these sections, is to give yourself, your staff, and your clients grace. This is new. We haven't done this before. And so really making sure that when you come into the concept of re-entering the workplace, re-entering the public workspace, making sure that you're just coming in with that idea of grace, that we're going to make some mistakes and people are going to get upset and there's going to be some things that you have to try a different way. And, hopefully the mistakes don't become that there's an illness, but the likelihood is also there that someone in your workplace will get sick. The numbers are high enough that we can expect that could occur. So giving yourself some grace. The second big thing I would encourage is learning the expectations for your industry. So the laws, the expectations, the licensing requirements, what is your industry being asked to do right now? So as the employer or the leader, it's really important to be familiar with that. That's a hard balance because some of the things you guys have heard from these previous speakers is not overindulging in the information. So knowing what you need to know and not just constantly feeding yourself the information or the scary facts. But as someone who's beginning to open up a business or open up an office or consider seeing clients again, you really do have to be somewhat familiar with what's being expected of you or what your options are with opening your workplace. One of a couple good resources for that would be just looking at your local Chamber of Commerce page. So I know that all of our local Chamber of Commerce have been doing a lot of work around making sure resources are available, that laws are clear, that expectations are clear. Look at your licensing website. So whichever type of entity is licensing your business, their websites often have lots of information about the regulations. And you can also go to virginia.gov/coronavirus, and they've got information there too about what are statewide expectations and laws. So once you've kind of approached with grace and you know the expectations, now you got to prepare. So three big things: prepare the stuff, prepare the space, and prepare your staff. So start with preparing the stuff. So right now, getting hand sanitizer is not quite as hard as it has been, but it's still a little bit difficult. So if you know that you're getting ready to approach and open a business, then you need to be prepared to have the things. So if you're going to have expectations for people wearing masks or gloves, hand washing, upping, and so needing extra soap or paper towels, be prepared with those things because that's a little detail, but it can make a huge difference. Be prepared with the space. So one of the things that when I came into working in the public again that we didn't have was the signage. And so, we're seeing it everywhere, but if you have a small group of people that are used to coming to the office and you kind of told them what to do, you may not think about that, but it's really important to have those reminders. So have the signage about keeping 6 feet. Make sure you've marked if that's an expectation for people to be 6 feet apart. Put up your signage to tell your expectations. It's not fair to expect a client or your staff to know innately the expectations or to know your expectations in this space. So make sure you're really clear with that and have some signage and markers. And then the last thing to prepare is your staff. And this is a really important component because when we're talking about people that are coming back into the workplace from working from home, there's a lot to consider. And so, I know because I've done this personally, we need to think about if they're going to be expected to use PPEs, we need to train them. Like they need to know, how should I use my gloves and how often do I need to change them and how should I wear my face mask for it to be effective? So making sure that your staff knows, again, it's really, you don't want to assume that just because this is in the media and it's being talked about that people know how to utilize those things when it comes to actually interacting with their clients. Train them on the new expectations for themselves and for customers. So take the time to have those conversations. In my current setting, we had a kind of quick decision made about wearing masks and gloves, and then there was no guidance on it. And so we had to kind of come back around as a leadership team and talk about it and decide how it should look, and then talk about how do we train staff. And that was something that from the highest up was kind of assumed, if we just put out this policy that you need to wear masks and gloves, everybody knows what we mean and knows how to do it. And that wasn't accurate. And so, it's really important to train your staff on the procedures and the expectations for the clients or the customers. So making sure that you have that time set aside. Take time, make time. give time for them to talk about their concerns. This is scary. It's a new precedent to come to work especially somewhere like an office setting where you're expected to wear a mask and gloves, wash your hands before entering, maybe check your temperature when you enter the door. That's new and different, and it's stressful. And so we really need to make sure that we give our employees and our teams that space and time to express their concerns. They're going to be worried about themselves. They're going to worry about where they're taking their children or who's keeping their children. They're going to be worried about what they're taking home. They're going to be worried about finding childcare. They're going to be worried about having time when they're used to being home with their kids. As stressful as it is to balance, it's really different when you move out of that realm. And I'll tell you, I've had some teary-eyed moments watching commercials that are talking about, this new normal for a lot of people is working at home with their children. Well, those of us that aren't have kind of the flip side of that being painful too. We don't get to see our kids all day, and we're not having to balance being a school teacher and being whatever our role at our job is at the same time. But it doesn't mean we don't have to do those things, and we're missing that time together. And so there's a lot of really great commercials out right now about how awesome this is that you get to spend all this time with your family. So when you have people entering the workforce out of the home again, we need to be really mindful of how that feels. And it's not necessarily the most warm and fuzzy feeling to leave their children at home now, because we are used to that. And a lot of people have figured out some balance. And so now to put into that balance, working out of the home, it does make a difference. And so take the time to let them know that you hear that, and that it's a concern, and let them talk about it. And then the last thing to prepare is yourself. So as a leader, you're going to be scared too, and you're going to have concerns, and you're going to have questions, and you're going to have to figure out, how does a policy work for your office and your clients? And, again, thinking about wearing masks, I work in a childcare center. Like, we have children that will not come to their teacher if they're wearing a typical mask. And so, it's really, as a leader, you need to give yourself that grace and that space to think through things, and to, figure out who can be that sounding board about your concerns, and allow yourself to be concerned and ask questions. Get my 2-minute warning. And then explore your company's EAP policies. So this is a stressful and traumatic time. See what resources you have to offer your employees. So flipping it over real quick to our employees, and I'll go through these kind of quickly. So as an employee that's going back, again, give yourself and your leaders and your clients grace. This is new and different, and we're all really learning how to navigate a world that looks different. Know that it's okay to ask questions. So your leader is trying to figure out a million different new regulations and perspectives and implications of actions. It's okay to ask questions. So as an employee, if you're unsure of how something works or what it should look like, ask, because you need to be clear on the policies and the expectations in order to implement them well. Make a reentry plan for your family. So have a plan for how you're going to come home and not share germs. So in our house, I go home when the girls are not coming to school with me, I go home, change clothes, spray off my shoes, sanitize my hands, my keys, my phone, and then I go pick them up. And I also use hand sanitizer before I get in the car, kind of thing. My husband has a way that he kind of disinfects before he interacts with the kids. So have a plan. The other big thing I would say for employees is also set aside that time in the evening for your families. So again, make a plan for how are you going to navigate that switch from being with your kids and your family all the time to going back into that limited capacity. And unfortunately, our limited capacity doesn't necessarily mean less is expected of us in that moment. And also utilize your company's EAP program. So there are resources out there if your mental health is being stressed by this change. Please do not hesitate to ask your leadership for some support or what supports are available, or reach out to any of your mental health providers. This group is full of them that can help you out and give you some additional resources. You're not in this alone, and you don't have to try to do it alone.
Awesome. Thank you so much, Katie. I really appreciated you talking about that anxiety about re-entering the workforce and things reopening, because I think that that's something everybody is dealing with right now as things start reopening. So I really appreciated that. I don't see any questions coming through as of right now. So I think we'll give it a few minutes while we're doing that. Let me see where I wrote it down. Our next Meet Yourself event is in 2 weeks on June 10th. And we're going to be talking about how we alter our services to provide services remotely during the time of COVID. So please join in us for that and register for that beforehand, so we just know how many people are coming, how to expect how many people are coming, and that'll be in that follow-up email that Jess sends, I'm sure, as well as it was in the email for today's presentation as well. That one we are going to do a little bit differently, where we're going to have some breakout groups at the end. So after each presenter presents, then you'll actually be able to talk with the presenter for a little bit longer and talk about with the presenter that's most closely related to your organization and business. So that's a really exciting one that's coming up as well.
So Ashley,
I still don't see, yeah.
I was just gonna say maybe people would prefer to just jump in and ask their question directly, since we don't have any via chat.
Yeah, so we will open it up. If you want to jump in and ask a question, go ahead and unmute yourself and ask to whoever you would like to.
Hello?
We can hear you. Go ahead.
Yes, I've been having some anxiety about going back to work because I have been working at home. I don't know how I can talk to my employers about that anxiety that I'm feeling.
Yeah, so Katie or Andy, do either of you have some tips?
One of the key things that I've really encouraged within my employees and within our organization is, as we've entered phases or changes, that we've reached out to employees. So that's kind of an encouragement from the leadership side, is to reach out to your employees as you reach new phases, so that they have that open line of communication. But if they have not reached out to you and you're kind of seeking their help and maybe seeking, do we have EAP services, or do we know more about the plan? I'm a really big proponent of just asking that question. Like, as an employee during this kind of unprecedented times, I think that we need to, as employees, we have to kind of feel a little step up of emboldened that we can ask those questions, because it really is your right. If the expectation is you're going to come back into a mixed office setting, then it is your right to know what's the plan and how are we going to maintain for employees as well as clients to ensure that safety. So I would really encourage you to reach out to your kind of your immediate supervisor to just say, you know, hey, do we have a plan yet? I'm just trying to I'm grappling with what this could look like. Do we know anything yet? Or even as a leader, one of the things that I love to hear the most, especially in a time like this, is, hey, could I help talk through this? And that's really helpful if an employee comes to me and says, you know, I'm concerned, but I'm also willing to be a sounding board. Can we talk about this? Like, I have some ideas, or I'm not sure what it looks like, and I know you've got to be really stressed about it. Could we talk? And so if you have a supervisor that you would feel comfortable maybe approaching in that way and saying, you know, I know it's going to happen. I've been a part of this listening session and I have some ideas, or I've been a part of this listening session and it brought up some questions I have about how we're going to do this. Could we talk about it? I bet that your supervisor will be really thankful that someone's willing to have the conversation and that he or she isn't left to kind of manage it independently.
Yeah, I would just say, just to kind of piggyback off what Katie was saying, I'd say transparency and trying to be as transparent as you can with your employer. So even if the employer does have a policy and you're just super not comfortable with it, I think, like Katie said, it's your right to kind of talk about that, seek what services they may have available to help you through that anxiety, as well as, is there an alternative work plan that you can work through? But I think first and foremost, I mean, you're recognizing the symptoms within yourself. However, your employer, and hopefully it is an employer that you can talk to, doesn't know unless you talk to them. And I always say, you know, they can't fix what they don't know. And so, you know, because everyone, I think across the board is experiencing different levels of comfortability with the situation, it's hard to know for employers how everyone's feeling unless you kind of bring that up to them. So I know that that's a lot of vulnerability, but I think that that's the only way, you know, I think right now you've got to be an advocate for yourself and getting your needs met. And if there is concern about, you know, the idea would be if you went back to work, your anxiety could increase, and that would lead to, you know, more problems for you, as well as a decreased quality in your work, as well as, you know, a whole slew of other things. So I'm with Katie. I encourage you to kind of advocate for yourself and try to talk with them, and just be, you know, kind of ask those questions first, what's out there for me, and, you know, go from there. And hopefully, you know, they will extend grace like, you know, most people have been trying to do, you know, but I know that that's not across the board. So.
Yeah, does anyone have suggestions for if, I mean, there's plenty of people who are in a situation where their employers are not as great as you all. And, you know, right now it's a hard time. A lot of people are losing their jobs, you know, fear of losing your job, but then also, you know, that you can't express the anxiety you might have about going to work. So does anyone have suggestions if they feel that they can't have that conversation with their employer? I know that's a tough question, so but I thought I'd throw it out to the group.
You know, the HR folks, you know, your human resources folks are sometimes external from your direct supervisor or from management, you know, so HR is used to dealing with this, you know, they're used to dealing with individual concerns, individual circumstances, and certainly as it relates to caring for a family, you know, if you have a unique situation at home where someone is immunocompromised, and so you have an even greater risk or greater concern about infectious disease, you know, it makes sense, and it is, you know, disclosing more personal information, so it makes sense to go to the HR route, which in some cases can be a little bit independent of immediate teams that you were working on.
Thank you.
Do we have any other questions? Okay, I just want to share just a resource that I know about. The New River Valley Public Health Task Force put out a document about reopening for businesses, and that's a great reference of different considerations to make while you're reopening your business as well. So I can make sure that Jess has that link, but if you just search New River Valley Public Health Task Force, you can find it as well. I think it's on the Montgomery County page, posted there, and I think it's posted a few places. There's also another resource in the New River Valley called Looking Out for Each Other New River Valley, and they just launched a website, and they do have a section about Know Your Rights. I don't know if it's pertaining to work conditions, but I know different like housing conditions and things like that, but they might have a resource on there as well for knowing your rights as an employee that could be helpful in approaching that supervisor as well, posted on that. And that is just, they've collected a lot of different resources on that webpage as well. I don't see any questions. If somebody has a question, go ahead and jump in.
And if there's not any questions, perhaps if someone else has information to share, other resources that maybe we didn't include, or other topics that would be helpful to include in upcoming events.
Okay, I'm not hearing anything. Jess, is there anything else that you wanted to cover?
No, I don't think so. I will mention that the resource, Ashley, that you mentioned from the NRV Public Health Task Force is posted to the Community Foundation's website, cfnrv.org, and just on our homepage, the first thing you'll see is a link to COVID-19, and we have a resource page that has that there. It's a great document, so I'd encourage folks to look at that. And then I put in the chat where you can find recordings of these sessions. And of course, folks are welcome to email me if they have other suggestions on topics that they would like to have for this, or members of the First Steps team as well. That's all I've got.
Awesome. Well, I want to thank everybody for joining us today. And thank you to our presenters for sharing all that wonderful information with us. And just remind everybody, in 2 weeks, June 10th, we'll be having another one of these. This is going to be a little bit longer to allow that time for those breakout sessions. But we're going to be talking about providing services and communicating with clients remotely during this time. So thank you again. I hope everybody has a wonderful day.
Thanks. Bye.